enlargement and spaces. Two major enlargements in the spinal cord. Cervical enlargement, thoracolumbar enlargement. Cervical enlargement. It is due to collection of neuron bodies that contributes to brachial plexus. Root value of cervical enlargement is C3T2. C3T2. Cervical enlargement. C3T2. However, root value of brachial plexus C5T1. Root value of brachial plexus C5T1. Thoracolumbar enlargement. It is due to collection of neuron bodies that contribute to lumbosacral nerve that supplies the lower limb. It is protected by T9 T12 vertebra. Root value of thoracolumbar enlargement L1S3. Root value of sciatic nerve L4S3. Supplies lower limb. Thoracolumbar enlargement protected by T9 T12 vertebrae. Root value of thoracolumbar enlargement L1S3. Sciatic nerve L4S3. Phylum terminale, it has two parts. Pial part, it is longer than dural part. It reaches until the lower border of S2 and marks the termination of subarachnoid space. Pial part of phylum terminale is adherent to pia mater. Dural part, it is shorter than pial part. It is covered by the pia mater and dura mater. It attaches to the coccyx bone. Pial part, dural part, phylum terminale. Patient position for lumbar puncture. For performing the lumbar puncture, the patient is put in flexion attitude. Here we feel for highest point of iliac crest and draw a straight line. The intercostal plane is at level of L4 vertebra. Here needle can put to aspirate the CSF or for lumbar anesthesia. Spinal nerves. Cervical spinal nerves. There are 8 cervical nerves. Each cervical nerve exists above the corresponding cervical vertebra. 8th cervical nerve passes above the T1 vertebra. Cervical spinal nerves have short and straight course. Thoracic spinal nerves. Each thoracic spinal nerve passes below the corresponding thoracic vertebra. Lumbosacral spinal nerves. Each spinal nerve passes below the corresponding vertebra. These nerves are long and more oblique. This is because the spinal cord has already stopped below the L1 vertebra and nerves keep coming down to exit at their corresponding vertebral level. Cervical spinal nerves. There are 8 cervical nerves. Each cervical nerve exists above the corresponding cervical vertebra. Each cervical nerve passes above the T1 vertebra. Cervical spinal nerves had short and straight course. Thoracic spinal nerves. Each thoracic spinal nerve passes below the corresponding thoracic vertebra. Lumbosacral spinal nerves. Each spinal nerve passes below the corresponding vertebra. These nerves are long and more oblique. This is because the spinal cord has already stopped below L1 vertebra and nerves keep coming down to exit at their corresponding vertebral level. Slip disc. 90% is seen in lumbosacral region, 10% in the cervical region. Slip disc is very rare in thoracic region. In cervical region, corresponding nerve in intervertebral disc is involved. In lumbosacral region, next nerve below is involved. Example, in case of slip disc between L4 and L5, L4 root is not involved. Rather, L5 nerve is involved. Herniated disc between C4, C5, 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 C6, C6. Between C6 and C7, compressed nerve root is C7. L3, L4, L5, L4, L5, 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 S1, S1. The next disc is, that nerve is compressed. In case of midline herniation of nucleus pulposus, all the nerves coming below the level are involved. Trick to find the nerve involved in the slip disc, go to the upper vertebra and add +1. Example, case 1. Patient comes with burning sensation in middle finger C7 dermatome, tested with C7 myotome. Triceps reflex is weak. Therefore, slip disc is C6 and C7. Herniated disc between C6 and C7. Compressed nerve root is C7.